Here are some important points to consider uh, as we discuss the issue of concussions in youth. As you probably realize, children are more active than most adults and they participate in more risk-taking behaviors. For example, on the playground, on bicycles, using skateboards, etc. This type of behavior puts them at risk for concussions from non-sport activities. And coaches should be aware that children may actually come to practice or competition with a concussion sustained from outside of their sport. Once a concussion has happened, children and adolescents are more likely to sustain additional concussions over time. They're actually 4 to 6 times more likely to experience a second concussion after they've had the first. They also take longer to recover and to heal than do adults, sometimes as much as twice as long as the adults take. With children, delayed reporting of symptoms may occur for several different reasons. Children may deny their symptoms so that they can continue to play. Or they may not relate those symptoms to a concussion, or they may unconsciously ignore such symptoms. Some symptoms may not manifest themselves immediately because the child hasn't exerted enough energy to cross the symptom threshold. Children may not know how to express just how they're feeling and may simply say that they're not feeling well. We know that girls have higher rates of concussion and appear to take significantly longer to heal than boys, sometimes as much as twice as long. Why is still a matter of conjecture. Current research is still looking to explain those differences that we've found in concussions between males and females. Another important point to consider is that no one can really predict how long it will take to recover from a concussion. According to the Berlin Consensus Statement of 2016, a statement compiled by the top experts throughout the world on concussions, the severity of the initial symptoms is the best indicator of how long an athlete will require for complete recovery. Length of recovery can be influenced by many factors, including the force of the hit that originally caused the concussion, the existence of any coexisting issues or injuries, or how well the patient actually is able to follow a treatment plan. A concussion can occur whenever there is an event that causes the brain to move inside of the skull, as depicted on the slide. Since the brain floats in cerebral fluid inside of the skull, it can move back and forth as shown in this picture. And depending upon the velocity and the direction of the force, the brain can twist and rebound as a result of a hit. With concussion or mild traumatic brain injury, this movement sets off a chemical chain of events within the cells of the brain. It is not a bruise to the brain nor a bleed. And it doesn't kill brain cells, but rather it alters the way the cells function, which is why we think of a concussion as a functional injury rather than a structural one. While many concussions result from a direct blow to the head, to the face, or the neck, an indirect blow elsewhere on the body can transmit its force to the brain, resulting in a concussion. And again, as a reminder, concussions can often occur without experiencing a loss of consciousness. When the force becomes so extreme that it causes bleeding, bruising, and cell death in the brain, then we have structural damage that can actually be seen on a CT or MRI scan. CT stands for computerized tomography, while MRI is short for magnetic resonance imaging. Concussions typically cannot be detected by CT or MRI scans. From many other circumstances and activities like falls and car crashes. Regardless of how the concussion happens, the signs and symptoms are the same. So if a player has taken a fall or was in an automobile accident or was hit by or against something and they do not tell you, you may see the signs of mild traumatic brain injury as they engage in practices and competition. If you observe a difference in the player's behavior, it's a good idea to talk with the player and ask about how they are feeling or speak to the adult in the child's life. The risk for another concussion goes up as well as other types of injuries following each concussion. The functional changes in the brain are evidenced by changes in thinking, behavior, and emotional stability. As a result, as described in this slide, virtually every dimension of a child's life may display negative symptoms. Schoolwork, relations with family and friends, day-to-day behavior, feelings, and even physical health may all be altered. When mild traumatic brain injury is managed properly, these negative effects can be minimized in severity and even duration. Mild traumatic brain injury that is not properly managed can result in a longer recovery, which can lead to depression and anxiety, even further complicating a child's life. Pre-existing conditions can affect the brain, and they may confound the ability for us to make an accurate assessment, and they may directly affect the length and the complicated aspect of the recovery. Here's a short list of pre-existing conditions that can affect recovery. Do we know how many concussions a student may have had in prior years? And if multiple concussions had been experienced, how far apart in time were they? Is there a history of any physical conditions like migraines, seizure disorders, or thyroid dysfunction, which can complicate assessment and prolong recovery? Are there any co-occurring psychological conditions like anxiety, depression, or a sleep disorder that can hide the symptoms or complicate recovery? Learning disabilities such as ADHD or other learning disabilities can make following a treatment plan more difficult and also complicate recovery. Medications like antidepressants or those prescribed for attention deficit syndrome can mask symptoms. Sleep can be affected by a concussion. Youngsters can have a hard time falling asleep or staying asleep, or they may have a hard time staying awake. Too much sleep or too little sleep can be both the result of a concussion and in turn slow and complicate the recovery. The CDC has recommended that public and private schools establish a concussion management team, which, once informed of a child's serious injury, regardless of whether that concussion occurred in school or not, can develop an individualized plan to help the youngster in school during recovery. You're helping the families become aware of such a resource can go a long way towards supporting their child's recovery. Let's speak now about a concept called baseline testing. It's an important topic, but its role in youth sport is still optional. A number of different baseline tests are available that help us to provide a snapshot of how the athlete functions prior to a concussion in terms of vision, balance, and cognition. Cognitive baseline testing is commonly used in the high schools. Many medical practices and concussion centers use baseline testing software as a part of a treatment program as a way to get additional information about a player's progress as they heal from concussions. It is one of the tools a clinician can use to help determine safe return to play. Baseline testing documents an athlete's concussion history and is used to compare baseline scores prior to a concussion to post-injury scores for the individual athlete. It is not for comparing one athlete to another, nor does it determine which athletes are more at risk for concussions. Unfortunately, some athletes deliberately do poorly on the baseline testing, thinking that if they experience a concussion later on, they will be able to get back in the game sooner. Such misguided thinking is the result of not appreciating the serious nature of a concussion, such as mild traumatic brain injury. The consensus statement from the Berlin Summit of 2016 states that baseline tests are not mandatory in youth sports, and the new clinical guidelines that the CDC has recently released does not recommend baseline testing for youth sports either, primarily because such testing appears to lack clinical validity. Let's speak now about your role as the coach. So how does all this affect you? Every coach knows that safety is a priority. However, safety in the context of concussions can still be quite a challenge. The first three bullets on the left side of this slide under creating a culture of safety are well known and probably the most practiced by coaches everywhere. But there's always room for improvement. How can you improve on your behavior that models safe play, expects safe play, and reinforces safe play? How do you show your players that you care about how they feel as well as their physical safety? The last bullet on the left side is probably the most difficult. Resisting the pressures to let a player play when there's good reason to suspect a concussion. Pressure to continue to play may come from the players themselves, from other teammates, parents, and even the fans. Hopefully, the perspective provided by this course will give you the confidence that you need to stand by your decision to hold out a player when necessary. If you can provide affirmative answers to the questions posed on the right side of the slide, the chances are that you are successfully creating a culture of safety. Do your players believe that their safety is your first priority? Would your players report a possible concussion to you, whether it's their concussion or a teammate's? Do your players mistakenly believe that when you pull them from the play, it is to punish them? Let's talk about what we sometimes refer to as the bottom line. It takes strength, courage, and conviction to remove a player who wants to continue to play when you suspect there may be a concussion. Doing the right thing in the heat of the moment can often be difficult. Your actions and examples as the coach has some degree of influence on your players. One caring adult in a child's life can make a huge difference. Whether you coach the same players for years or you have them only for one season, you are part of their life experience that helps form their character. You can be instrumental in preparing them for their future. Injury to a child's brain can change that future. Concussion or mild traumatic brain injury is certainly a risk in many youth sports, but it is a brain injury from which a person can recover. However, an accumulation of concussions over a short period of time can have a significant negative and long-lasting effect on a child's development. Playing sports while still suffering from a concussion is dangerous because the risk of a second concussion is substantially increased. No one expects you to be able to diagnose a concussion. Only a qualified medical professional can make such a diagnosis or rule out a suspected concussion. However, you are expected to be knowledgeable to the extent that you know the signs and symptoms of concussions and know what to do if you suspect that one of your players may have suffered a concussion. The best defense against more severe brain injury is to understand that concussions need adequate time to heal completely, and the time to recover will differ from athlete to athlete. This completes part 2.